Cardiologist reveals the #1 medication destroying senior hearts. Millions take it daily. Before you take that little pill in your medicine cabinet today, you need to hear this. Right now, over 20 million Americans over the age of 60 are taking a medication their doctor prescribed to help them, but according to leading cardiologists, this same drug might be quietly damaging their heart with every single dose. Margaret was 68 when her doctor put her on this medication for her aching joints. 3 months later, she was rushed to the emergency room with heart failure. The shocking part? Her doctor never warned her about the cardiac risk. If you or someone you love takes medication daily, the next few minutes could literally save a life. Stay with me. Hello and welcome back to the channel. If you're new here, I'm dedicated to bringing you honest, research-backed health information that actually matters for those of us over 60. Today we're going to talk about something that doesn't get nearly enough attention in doctors' offices across America. A class of medication that millions of seniors take every single day, often without understanding the serious risk it poses to their hearts. I'm talking about NSAIDs, or as you probably know them, Ibuprofen, Naproxen, and similar over-the-counter and prescription pain relievers. Now, I know what you might be thinking, but my doctor recommended these, or I've been taking these for years. And that's exactly why this conversation is so important. According to recent studies published in the Journal of the American College of Cardiology, long-term use of these common medications increases the risk of heart attack by up to 50% in older adults. 50%. So let's dive deep into what every senior needs to know about these medications, the hidden dangers, and most importantly, what you can do to protect your heart starting today. What are NSAIDs and why are they so popular? First, let's talk about what NSAIDs actually are. NSAID stands for non-steroidal anti-inflammatory drug. That's a mouthful, I know, but here's what it means in plain English. These are medications that reduce pain, lower fever, and decrease inflammation, but they're not steroids. The most common ones you'll find include Ibuprofen, sold as Advil or Motrin, Naproxen, sold as Aleve, aspirin, though this one works a bit differently, and prescription versions like Celebrex, Mobic, and Voltaren. Now, why are so many seniors taking these medications? Well, as we age, our bodies change. Arthritis becomes more common. Joint pain, back pain, headaches, these become almost daily companions for many people over 60. And when you're in pain, you want relief. That's completely understandable. NSAIDs work fast. Pop a pill and within 30 to 60 minutes, that nagging knee pain or stiff shoulder feels better. No wonder they're so popular. In fact, studies show that approximately 1 in 5 adults over 65 uses NSAIDs regularly. That's more than 20 million American seniors. And here's the concerning part. Most of them buy these medications over the counter without discussing long-term use with their doctor. Because they're available without a prescription, many people think they're completely safe. It's just ibuprofen, right? What could go wrong? Well, that's where the story gets serious. Let me explain how these medications actually affect your heart, and I promise to keep it simple. Your body produces natural chemicals called prostaglandins. These chemicals do many things, including protecting your stomach lining and helping your blood vessels work properly. They also cause inflammation and pain when you're injured or sick. NSAIDs work by blocking the production of these prostaglandins. That's why the pain goes away. Less prostaglandins means less inflammation and less pain signals. But here's the problem. When you block prostaglandins throughout your entire body, you don't just block the pain. You also interfere with several critical functions that protect your heart. First, NSAIDs raise your blood pressure. They do this by affecting how your kidneys regulate salt and water. When your kidneys hold on to more salt, your blood pressure goes up. For seniors who already have high blood pressure, which is about 2 out of 3 people over 60, this is adding fuel to the fire. Second, NSAIDs increase your risk of blood clots. These medications interfere with your blood's natural balance. While aspirin actually helps prevent clots, other NSAIDs can make your blood more likely to clot. And blood clots, as you may know, are a leading cause of heart attacks and strokes. Third, NSAIDs can cause fluid retention. Have you ever noticed your ankles swelling after taking ibuprofen for a few days? That's fluid retention. Your body is holding on to water it should be releasing. This extra fluid puts strain on your heart, forcing it to work harder to pump blood through your system. And fourth, NSAIDs may directly damage heart muscle. Newer research suggests that these medications might actually weaken the heart muscle itself over time, especially in people who already have some heart disease. Dr. Robert Johnson, a cardiologist at Johns Hopkins, puts it this way: For older adults with existing heart conditions, taking NSAIDs regularly is like asking someone with a broken leg to run a marathon. You're demanding more from an organ that's already struggling. Now, if you're feeling anxious hearing this, especially if you've been taking these medications, take a deep breath. Knowledge is power. Understanding the risk is the first step to protecting yourself. The research that changed everything. Let me share with you some of the research that's been raising red flags in the medical community. A landmark study published in 2017 followed over 10 million patients across 4 countries. The researchers found that people who took NSAIDs had a 20 to 50% increased risk of heart attack compared to those who didn't take them. But here's what really shocked the researchers. This increased risk started within the first week of use, not after months or years, within days. Another study from the American Heart Association found that seniors with existing heart disease who took NSAIDs regularly were 40% more likely to be hospitalized for heart failure within 1 year. And the European Society of Cardiology conducted research showing that the risk is dose-dependent. That means the more you take and the longer you take it, the higher your risk becomes. Now, I want to pause here for a moment because if you're over 60 or if you're caring for an elderly loved one, this information could genuinely be life-saving. Many doctors are wonderful, caring professionals, but they're also incredibly busy. Sometimes in a 15-minute appointment, there simply isn't time to discuss every risk of every medication. That's why you need to be informed and ask the right questions. If this information is valuable to you, please consider subscribing to this channel. We publish well-researched health content specifically for seniors every week, and it's completely free. Just click that subscribe button below so you don't miss future videos that could protect your health. Now let's talk about who is most at risk. Not everyone who takes NSAIDs will have heart problems. The risk varies from person to person based on several factors. You're at higher risk if you, number 1, already have heart disease. If you've had a heart attack, heart failure, or have been diagnosed with coronary artery disease, NSAIDs are particularly dangerous for you. The FDA has issued specific warnings about this group. Number 2, have high blood pressure. Since NSAIDs can raise blood pressure even further, people with hypertension need to be extremely careful. And remember, high blood pressure often has no symptoms, so you might have it without even knowing. Number 3, have kidney problems. Your kidneys and heart work closely together. If your kidneys aren't functioning well, NSAIDs can make things worse for both organs. Number 4, take NSAIDs regularly for chronic pain. Taking an ibuprofen once in a while for a headache is very different from taking it every day for arthritis. It's the long-term regular use that creates the greatest danger. Number 5, are over 65. Age itself is a risk factor. Our bodies process medications differently as we get older, and we're more likely to have other health conditions that increase our vulnerability. Number 6, take high doses. Taking 800 milligrams of ibuprofen 3 times a day is much riskier than taking 200 milligrams once in a while. Let me tell you about Robert. He's 72, loves playing golf, and had been taking Naproxen twice daily for knee pain for about 2 years. He felt fine, no symptoms, no warning signs. Until one Saturday morning, he woke up with chest pain and shortness of breath. The emergency room doctors found significant fluid around his heart, a condition called pericardial effusion, directly linked to his NSAID use. Robert was lucky. He got to the hospital in time. But his story is a powerful reminder that just because you feel fine doesn't mean these medications aren't affecting your heart. If you're currently taking NSAIDs, you need to watch for these warning signs. If you experience any of them, contact your doctor immediately. Number 1, swelling in your legs, ankles, or feet. This is often one of the first signs of fluid retention and possible heart strain. Many seniors brush this off as just getting older, but it deserves attention. Number 2, sudden weight gain. If you gain more than 2 to 3 pounds in a day or 5 pounds in a week without changing your diet, this could be fluid retention from NSAIDs. Number 3, shortness of breath. Especially if you notice you're getting winded doing activities that used to be easy for you, climbing stairs, walking to the mailbox, or even lying flat in bed. Number 4, unusual fatigue. We all get tired, but if you're suddenly exhausted doing normal activities, your heart might be struggling to pump efficiently. Number 5, chest discomfort or pressure. This is the big one. Any chest pain, pressure, tightness, or discomfort needs immediate medical attention. Don't wait. Don't wonder if it's serious. Call 911. Number 6, rapid or irregular heartbeat. If your heart is racing, fluttering, or beating irregularly, this could signal a problem. Number 7, persistent cough or wheezing. When fluid backs up in your lungs due to heart problems, it can cause a persistent persistent cough, especially when lying down. Here's something many seniors don't realize. Women often experience different heart attack symptoms than men. Women might have nausea, back pain, or jaw pain rather than the classic chest pain. So don't ignore symptoms just because they don't match what you think a heart attack should feel like. Now, I know what you're thinking, but I need something for my pain. I can't just suffer. You're absolutely right. Pain deserves to be treated. But there are safer approaches, especially for long-term pain management. Let's talk about alternatives. Number 1, acetaminophen, also known as Tylenol. This pain reliever works differently than NSAIDs and doesn't carry the same heart risks. It's generally safer for your cardiovascular system, though you do need to be careful not to exceed the recommended dose because of liver concerns. Number 2, topical treatments. Creams, gels, and patches that you apply directly to the painful area can be very effective. Products containing menthol, capsaicin, or even topical NSAIDs deliver relief right where you need it without the systemic effects that endanger your heart. Number 3, physical therapy. I know, it sounds like more work than just taking a pill, but physical therapy addresses the root cause of pain rather than just masking it. Many seniors find that a few weeks of targeted exercises provide longer-lasting relief than medications ever did. Number 4, heat and cold therapy. Simple, old-fashioned, and effective. Ice packs reduce inflammation. Heating pads relax muscles and improve blood flow. Alternating between them can work wonders for joint and muscle pain. Number 5, gentle exercise. This might seem counterintuitive when you're in pain, but activities like swimming, water aerobics, tai chi, and gentle yoga can actually reduce chronic pain over time while also protecting your heart. Number 6, weight management. Carrying extra weight puts additional stress on your joints. Losing even 5 to 10 pounds can significantly reduce knee and hip pain. Number 7, supplements. Some people find relief with glucosamine, chondroitin, turmeric, or omega-3 fatty acids. While research is mixed, these are generally safer than NSAIDs. Always check with your doctor first, especially if you take blood thinners. Number 8, alternative therapies. Acupuncture, massage therapy, and chiropractic care help many seniors manage chronic pain. Medicare now covers some of these treatments for certain conditions. Let me be clear, I'm not saying NSAIDs should never be used. Sometimes they're the right tool for the job. If you have an acute injury or occasional pain, short-term use might be appropriate. The key is to have an honest conversation with your doctor about whether long-term daily use is worth the cardiac risk in your specific situation. Here's what many seniors don't realize. Your doctor might not know you're taking over-the-counter NSAIDs regularly unless you tell them. When I talk to older adults, I often hear, "Well, it's just Advil. I didn't think I needed to mention it." But your doctor needs to know everything you're taking: prescriptions, over-the-counter medications, vitamins, and supplements. When you see your doctor, ask these specific questions. Question 1. Given my heart health and medical history, is it safe for me to take NSAIDs regularly? This forces a direct conversation about your individual risk. Question 2. What's the lowest effective dose I could take and for how short a time? If you do need NSAIDs, using the smallest dose for the shortest time reduces risk. Question 3. Are there alternative pain management strategies we should try first? This opens the door to discussing the other options we covered earlier. Question 4. Should I be monitoring anything specific while taking these medications? Your doctor might want to check your blood pressure more frequently or monitor your kidney function. Question 5. Do any of my other medications interact badly with NSAIDs? Drug interactions can multiply the risks. Blood thinners, certain blood pressure medications, and antidepressants can all interact problematically with NSAIDs. Also, bring a complete list of all your medications to every appointment. Include the names, doses, and how often you take them. This simple step can prevent dangerous interactions. Remember, you are your own best health advocate. Doctors are experts in medicine, but you're the expert in your own body. Partnership and open communication create the best outcomes. What to do if you've been taking NSAIDs long term? If you've been taking NSAID regularly for months or years, don't just suddenly stop taking them without talking to your doctor first. Here's what you should do. Step 1. Schedule an appointment with your doctor. Explain how often you've been taking NSAIDs and for how long. Be honest about the dose and frequency. Step 2. Get a cardiovascular checkup. Your doctor might want to check your blood pressure, do an EKG, or run blood tests to see how your heart and kidneys are functioning. Step 3. Work with your doctor to create a tapering plan. Depending on why you're taking NSAIDs, your doctor might recommend gradually reducing the dose while introducing alternative pain management strategies. Step 4. Address the underlying cause of your pain. If chronic arthritis is the reason you've been taking NSAIDs, it's time for a comprehensive pain management plan that doesn't rely on one medication. Step 5. Monitor your your symptoms. Pay attention to the warning signs we discussed earlier. Keep a simple log of any swelling, shortness of breath, or other symptoms. Martha's story is inspiring here. She had been taking ibuprofen 3 times a day for 5 years for osteoarthritis. When she learned about the cardiac risks, she worked with her doctor to transition to a combination of physical therapy, topical creams, and acetaminophen as needed. Within 3 months, her blood pressure had improved, the swelling in her ankles disappeared, and her pain was actually better controlled than it had been with the ibuprofen. Change is possible. Your heart can recover and strengthen when you remove the source of stress. Beyond just avoiding dangerous medications, let's talk about positive steps you can take to keep your heart strong and healthy as you age. Number 1, know your numbers. Blood pressure, cholesterol, blood sugar, and weight. These numbers tell the story of your cardiovascular health. Get them checked regularly and know what they mean. Number 2, stay active. The American Heart Association recommends at least 150 minutes of moderate activity per week for seniors. That's just 30 minutes 5 days a week. Walking counts, gardening counts, dancing in your living room counts. Number 3, eat a heart-healthy diet. Focus on vegetables, fruits, whole grains, lean proteins, and healthy fats. The Mediterranean diet has tremendous research supporting its heart benefits. Number 4, manage stress. Chronic stress is terrible for your heart. Find healthy ways to relax. Prayer, meditation, time with loved ones, hobbies you enjoy. Number 5, get quality sleep. Poor sleep is linked to heart disease, high blood pressure, and diabetes. Most seniors need 7 to 8 hours per night. Number 6, stay socially connected. Loneliness and isolation increase heart disease risk. Regular social interaction is actually protective for your cardiovascular system. Number 7, don't smoke and limit alcohol. If you smoke, quitting is the single best thing you can do for your heart. And alcohol should be limited to no more than 1 drink per day for women, 2 for men. Number 8, take prescribed heart medications consistently. If your doctor has prescribed blood pressure medication, cholesterol medication, or other heart drugs, take them exactly as directed. These medications are literally life-saving. Your heart has been beating every moment of every day for 60, 70, 80 years or more. It deserves your care and protection. Let's bring this all together. NSAIDs, those common over-the-counter pain relievers that millions of seniors take daily, carry serious cardiac risks that many people simply don't know about. They can raise blood pressure, increase the risk of blood clots, cause dangerous fluid retention, and even damage heart muscle. If you have existing heart disease, high blood pressure, kidney problems, or you're over 65, you're at even higher risk. But here's the good news. Now you know. Knowledge gives you power. You can have informed conversations with your doctor. You can explore safer alternatives for pain management. You can watch for warning signs. You can protect your heart. Taking control of your health isn't always easy, but it's always worth it. If you're caring for an aging parent or loved one, please share this information with them. Print out the list of warning signs. Go with them to their next doctor's appointment. Help them review all their medications. And if you've been taking NSAIDs regularly, please don't ignore this information. Make that doctor's appointment. Your heart, your family, and your future are worth that phone call. Remember, you've earned every year of your life through hard work, love, sacrifice, and perseverance. You deserve to enjoy these years with the best health possible. If you found this video helpful, please give it a thumbs up and subscribe to the channel. We publish research-backed health information for seniors every single week, covering topics that truly matter for those of us over 60. Hit that bell icon so you're notified when new videos come out. Your health is too important to leave to chance. And please, share this video with anyone you know who takes NSAIDs regularly. Your spouse, your siblings, your friends from church, your neighbors. This information could genuinely save someone's life. Drop a comment below and let me know. Were you aware of these cardiac risks? Are you planning to talk to your doctor about your NSAID use? I read every comment and I love hearing from you. Thank you so much for watching, for caring about your health, and for being part of this community. Take care of that beautiful heart of yours, and I'll see you in the next video.